Hi, my name is Reina Lombardi, and I'm an art therapist and mental health counselor, and I own Florida Art Therapy Services. And we've decided to bring you this series of conversations with the therapists that work at the practice. And we've titled it Expressions and Reflections, which we feel captures a lot of the work that we do with clients, helping them to express themselves more freely and um, connect with what's going on within themselves and find other ways to um, bring about meaning without words. Sometimes that's imagery. Obviously, using art, we use a lot of imagery, but it could be sculptural, it could be musical, it could be movement. And then, of course, the other part of that is reflecting upon that like once we're creating something, the important part of the meaning making comes back to reflecting upon that experience. Without further ado, here's our conversation.
All right. So, welcome if you're joining us to Expressions and Reflections, just conversations with the therapist at Florida Art Therapy Services. I'm Reina Lombardi, and I'm the owner of Florida Art Therapy Services. And I'm talking with Chelsea. You have Haveman on your name today. Did you change your name?
Oh, yeah, now my new married name. I haven't officially changed it, but Chelsea
Okay.
Darling Hapman, yeah.
Okay. So, but on the website, if you were to look on our website, Chelsea would be under Chelsea Darling. Um, so, Chelsea, why don't you share a little bit about who you are and what you do?
Sure. I'm a registered mental health counselor intern at Florida Art Therapy Services and also an art therapist. I'm EMDR trained, and I'm also trained in some other trauma-focused methods. And I've been working at Florida Art Therapy Services for about a year, and working with a variety of different populations here, children, young adults, and adults. And my history, my background, though, I used to work in partial hospitalization program and an intensive outpatient program, as well as a county psychiatric hospital. So I've had a wide range of experience in both art therapy and counseling.
Okay, wonderful. And so today, the topic we thought we would bring to listeners is on the topic of medical trauma and medical gaslighting. So let's start with like the topic of medical trauma. What would be a medical trauma?
Sure. Yeah. So medical trauma is usually a result of some sort of maybe medical procedure or diagnosis or treatment by a medical professional. So some symptoms that might pop up um, would be a range of like emotional kind of symptoms, anxiety, depression, common symptoms from PTSD like uh, flashbacks, nightmares. Some of those maybe like physiological symptoms, racing heartbeat, when you're maybe in a familiar situation, or sweating, shaking, things like that. Yeah, those are the common experiences.
Yeah, I've heard that like there's a whole like wide range of ways that people can experience medical trauma, including before they're born, like
Mm.
when they're in the womb and their mother experiences some kind of medical issue, emergency, or is in an accident or something that can create a medical trauma. We don't typically talk about like, oh, we're kind of in I would say in like regular life, therapists might talk about this, but in everyday community. We don't talk about, oh, the trauma that existed in the womb. Um,
Sure.
but it becomes stored in our cells, and anything medical that's happening for the mother is being filtered into the baby too.
Mhm. Yeah, yeah, that's definitely a interesting and unique circumstance that can occur for sure. There's some other ones that come to mind would be like just having a chronic illness or a severe illness of some sort, having to even just stay in a hospital, um, maybe almost dying during a procedure or having a near death experience of some sort, and that could also be like in the womb and that kind of case like that. Being injured maybe in a procedure or something by a medication, chronic side effects that are long lasting, maybe even lifelong, having to have consistent, maybe like very painful procedures after something, medical procedure or something along those lines. Yeah, those are some main ones that come to mind. Even individuals who have like an anaphylactic reaction to an allergy or something like that. That's something that's constantly maybe on their mind, and they're concerned that it could happen, and that can cause some symptoms there too.
Yeah, I could definitely see that. I know, like I do have pretty severe allergies to a number of things, but like I had incident one time where I got stung at the same time by like two, I want to say they were like hornets or wasps or something. And it was like down by my ankle, like my whole leg swelled up to the size of my thigh and my foot. It was really painful, made me vomit. My throat felt like it was closing up. It was like a horrible experience. And so
Yeah,
now I'm like, I definitely, when like those types of insects are around, I really take notice of like, okay, where are they?
sure. Yeah.
I don't want to go through that.
Mhm.
So I could see like if you have to use the EpiPen, which is definitely not a comfortable experience, like
Right.
that could be
Sure,
um,
sure. Or anxiety related to, all needing to always have it with you, and if you don't, how what that can kind of trigger.
right. Yeah, I think anytime we have surgery, even though it's so commonplace in our modern society, our body is not designed to endure that. Like that's not what is supposed to happen. So just that alone, even if it's elected surgery, could
Mhm.
be traumatic. Waking up from anesthesia
Right.
could be a traumatic experience of not knowing where you are. It's cold. You can hear all the voices around you, but it's super disorienting. You can't speak. You kind of know that you're there, but you don't know where you are. That can feel really frightening for people.
Sure. Or even I had an experience while I was having my wisdom teeth removed where I started to wake up in the middle of the surgery. And they had to put me back under, but I remember the moment of coming to a little bit and them rushing around, like saying that I was waking up. And I'm sure other people have experienced that, in other types of surgeries too. And that's a scary experience for sure.
Mhm. So, some of the things that I've heard about people that have experienced some medical trauma is um, whenever we experience something that felt life threatening to us in some way, even if it's irrational, like there wasn't a real threat to our lives, but if there's a perceived one, that our response, our brain says, oh, we want to take care of you. We want you to survive this. So we don't want you to feel comfortable going back in that environment. And so if that happens, that could be really problematic because, we live in a time where we still need medical care. Um, And if we're avoiding going to the doctor because of something that happened, um, that could create more problems for us and our physical health, which we know is very connected to our emotional and mental health, that these aren't two separate things. We live in one body, and both of those things function together. So, what should somebody do if they feel like they've experienced this and they're having some symptoms that cause them to want to avoid medical treatment, medical providers? Maybe they don't feel comfortable going to a hospital, or like maybe they don't feel comfortable getting any kind of shots or having their blood taken. Um, is there something that people can do to effectively move past that so that they can go and receive the care that they need?
Sure, sure. There's definitely a variety of things that they can do. One of them being EMDR, which I had mentioned earlier that I'm trained in. So EMDR is, to put it a quick explanation, it's a process that works within the brain to work through a traumatic or distressing memory. And you're using the brain's natural process to, the mechanism is called bilateral stimulation, which is basically just stimulating both sides of the brain, either through eye movement or tactile, like tappers or tapping on yourself. And so we're taking this memory, we're bringing it up, and it's currently kind of stored in like an easily accessible place, and more in like the short-term memory. And we're trying to get it to go back towards the like long-term memory, not easily recalled, doesn't put our body in that fight, flight, or freeze response when we maybe experience something that's similar. So yeah, through EMDR, we use that bilateral stimulation to process, work through the memory, and we take a negative thought that's kind of paired with the memory, right? And in these situations with medical trauma, it might be something along the lines of "I'm not safe," or "I'm out of something about control," right? Not being in control. So taking that, pairing it with that memory or distressing event that had happened and processing it through EMDR, and then eventually it will pair it with something that's like the positive side of what that thought should have maybe felt like it should have been in that moment. That I statement of "I'm not safe" becomes maybe "I'm safe now, I'm no longer in that situation." So it's like a controlled way to process through that distressing memory.
Okay. And how long does it take to do something like that, to where like you experience some EMDR around these like memories that you have that are distressing? How long does it take to get to that place where you feel like, oh, that negative belief and that distressing memory like really isn't distressing anymore, and I actually don't believe that that's true? Um,
Yeah, it depends on the person. It depends on the severity of the memory, or the severity of the distress in relation to the memory. So we actually use a scale that's a 0 to 10 scale in EMDR, and something that's maybe more distressing might take longer to process. It might not. It kind of depends on the person as well. I'd say within a few sessions, we can usually work through a distressing memory or traumatic event with a client. There is a process in the beginning of setting up EMDR where we have a couple sessions of talking about history, the process, doing some skill building of maybe like deep breathing exercises and having a safe place ready and things like that. So that's kind of our preparation. That takes a couple of sessions, and then we can focus on if it's only one like specific memory, you can focus for a couple of sessions on that one. So it's hard to give a solid answer of amount of time, but it could potentially be just a couple of weeks.
Nice. Well, I mean, that is in short order, a time frame, right? Like it's not
Mhm.
a year in therapy.
Yeah,
It's a pretty short duration of time, a handful of hours perhaps, to get to a place where maybe you were afraid and avoiding going to that doctor's appointment to be able to schedule it and go to it. Um,
sure.
that's pretty
Yeah.
impressive.
And that what you mentioned right there, even just like going to the doctor's appointment, not only can we work on the history and the memories from the past, but you can also target like future things that might happen that cause distress or anxiety. So we could look at that event of going to the doctor and how it's so anxiety provoking. We can also use EMDR to process that and make it a little less anxiety provoking.
Very cool. So if you were going to target, like say somebody was coming because they do have a medical trauma, they have a chronic illness that causes them to have to interact with the medical field. Because of that, what would that entail? Like, how do you do that? How do you do a future? Can you kind of paint a picture of that for folks that might
Sure.
be listening, that might be going, well, how do you do that?
Mhm. Yeah, so we would start off with a conversation about what would that ideal situation look like, right? Would it be walking into the doctor's office, not feeling any anxiety, no racing heart, we might identify some of those physical symptoms as well as how would they want to feel about themselves? Would they want to feel confident, like they could, speak up about whatever they have to, talk about. They could openly ask questions. They could maybe say something back to the doctor if they say something that is triggering to them or something that was maybe along the lines of gaslighting, right? Like having that confidence and ability to just navigate the situation in their ideal as if it was their ideal kind of outcome, right? So we would look at that and then we would go through what they call an EMDR as like the protocol, and we would identify those I statements about themselves, the things that they don't want to happen, racing heart, maybe sweaty hands, shaking of the voice, things like that. Um, and we would use the bilateral stimulation when I was mentioned before with either eye movements or the tapping, or you can have auditory like beeps on each side too. And they would close their eyes if they felt comfortable to and envision themselves walking into that doctor's office and going about the appointment as if that was their they had all of the confidence in the world. They could say what they needed to say. They didn't have any of those anxiety kind of symptoms or feelings, and that would be their outcome. So it helps them prepare and desensitize is the EMDR kind of word for it. That anxiety surrounding or distress surrounding the situation.
And so you mentioned the term medical gaslighting in there, that you could target that as well. For people that maybe are familiar, maybe they've heard the term gaslighting because it certainly has been in our current vocabulary a lot. I've seen a lot written about it, articles, people talking about it a lot. Um, what would that what is it? And then what does that look like as it pertains to medical?
Sure. So what it what I hear from clients a lot is it's a lot of minimizing maybe their symptoms, making them feel like they don't know themselves, they don't know their body, um, kind of how could they be thinking that way about what's going on for them, and it really maybe strengthens that like power dynamic between a doctor and a patient where they feel like they don't have much power in the situation and or knowledge even about themselves when they do know themselves well. So an example of that might be a woman who is experiencing a lot of pain and has a possible diagnosis of PCOS or endometriosis or something along those lines. And they're told, it's normal. It's normal for women to have this, what you're experiencing. You wear a heating pad every month and you'll get through it. Take some ibuprofen and be on your way, right? But they're not being heard necessarily when they're expressing what, like, the severity of the pain that they really are feeling.
Yes, it's like it's dismissed.
Mm-hmm.
And I think I've heard some doctors will like tell clients too, oh, you're just making it up, you're exaggerating. It really doesn't feel that way. Um, Other
Right.
things I've heard from different people is like, oh, you're just psychosomatic, which
Mm-hmm.
is a term, if you're not familiar, which means that what's going on in your psyche, what's going on in how you're feeling and thinking, is manifesting as a physiological symptom. Well, that could be the case, but there's still something to be addressed there. But oftentimes that term like carries like a really heavy stigma of like, oh, like I'm being shamed because I'm coming to you because you're a medical professional supposed to be helping me, but you're basically telling me there's something wrong with me because you can't help me, or you're not
Mm-hmm.
willing to investigate how to help me,
Right.
right? Which doesn't feel very good. Um,
Yeah.
yeah. So you were talking about kind of like the future preparation for people that feel like, they've given up speaking up for themselves. Cause I think a lot of times, for many people, they may have gone to multiple doctors and they hear the same thing. And then the doctors will like write in their chart and it will get passed on to another doctor,
Mm-hmm.
and that doctor won't hear the client out. They look at the chart and just see that the previous doctor has written, this person is like, whatever they say about them. But again, it's dismissive, it's minimizing, like you were talking about. And so then the new doctor doesn't even take those presenting problems and concerns that the client is discussing with them seriously and repeats the same process. And so sometimes I feel like after a while, people stop voicing their concern, and until it becomes a real medical emergency and they find themselves in, like, oh my gosh, why didn't you say something about this sooner?
Right.
And the
Right.
person's like, I've been complaining about this for years and nobody took me seriously. And now you're telling me why I didn't say something sooner.
Yeah, or sometimes they're even discouraged to reach out for medical support when they are in some sort of emergency situation.
hmm So, like, for people that maybe have been going through this a while and feel really defeated and like don't even have the energy to use their voice to advocate for themselves anymore because they feel like it's just been extinguished at every turn. How can you use EMDR to help them speak up?
Sure. Yeah, we can look at that core belief of I'm not heard might be the one to look at there for their negative thought. And that's ultimately what they felt over time again and again, right? I'm not heard. I can advocate for myself. No one's listening. So then that becomes, why should I even try, right? So through EMDR, we can look at one of those situations or all of the situations they might have experienced where they didn't feel like they were heard, or it could even be maybe I don't matter. They might feel like they don't matter
Mhm.
if they're expressing this concern or this need for so long, and it's just being shut down. So those would maybe be the negative cognitions in EMDRs, that's what we call them, that we would look at and pair them with those experiences that they had where they felt like they weren't heard, and work through them through EMDR.
Could you also do like what you were talking about with the future, like helping them to kind of rehearse those
Oh, sure.
scenes of
Yeah,
like
yeah.
speaking up and finding their voice again?
Right. That could, yes, yeah. Advocating for themselves, what would they want to say, preparing what they want to say and having them run through it through EMDR. Yeah, you could definitely do that.
Awesome. Yeah. So if there are people listening that might find themselves in a situation where they feel like they've been kind of struggling with a medical condition, and the medical community has been dismissive, um, or even the treatment that they've experienced has been traumatizing for them. If they wanted to reach out and work with you, um, to use EMDR to work through some of these things so that they can feel more empowered, and to release some of the trauma memories that have been stuck. I kind of feel like it gets stuck in the body,
Mhm.
and which then compounds the physical ailments that the person's already having.
Sure.
Um, what would be the best way for them to um, connect with you and like schedule an appointment with you to work on these things?
Sure. So they can call Florida Art Therapy Services, or they could send me an email. Um, my email is chelsea@floridaarttherapyservices.com. And I'm sure you can put the the number there for everyone too, our website. I actually have an online calendar via the website too. And you can see my availability on there and even schedule that way.
Okay,
And
awesome. Yeah.
yeah, and I do offer like a first 15-minute kind of get to know you session if you'd like to have a consultation at first and talk more about it for a few minutes and see if I'm a good fit.
Yeah, no, that sounds great. So, if you're interested and you think that you might be able to benefit from Chelsea's services, you can call 239-297-7099, or send her an email, Chelsea, CHELSEA, at FloridaArtTherapyServices.com. And yeah, well, we hope that if you're listening and you're looking for help, even if we're not able to provide it, that if we're not a good fit, we'll help connect you with somebody else in the community that might be able to help you and be a better fit for you. So please don't hesitate to reach out.